Hello, everyone. This presentation is going to cover part of Unit 2 in HIM 6502. Margaret A. has done a really great job in developing a presentation associated with Chapter 2 of her textbook, which is General Systems Theory and the Systems Development Lifecycle. And so I'm not going to lecture or narrate the PowerPoint for that. I would just like you all to go through that PowerPoint because it's really well done, and I think gives you a really great overview of system development lifecycle. So this will just provide you with an introduction to HIT. All right, so Health IT includes all components of an EHR, electronic health record, as well as additional information technology to support all aspects of the healthcare delivery system. So Health IT is really an expansive concept, and HRSA defines Health IT as the application of information processing involving both computer hardware and software that deals with storage, retrieval, sharing, and use of health information, data, and knowledge for communication and decision making. So health IT really includes electronic health records and other forms of information technology such as data warehousing and analytics, mobile apps, PHRs, personal health records, health information exchange, and the list can go on and on. And this course really explores many forms of health IT, and I guess one could really conclude that Health IT includes all components of an EHR as well as additional information technology to support all aspects of the healthcare delivery system. Okay, so let's talk about the electronic health record. So this slide really just addresses the definition of an electronic health record as defined by HDM, which was previously known as the Institute of Medicine, or IOM. So I'm not going to read this definition to you, but I would like you to read it. I think the most important thing here is just that we have a good understanding of what an EHR is, because the next slide is going to differentiate between an EHR and an EMR, as I'm sure you have all heard both terms used. All right, so what is the difference? So as it states here, an electronic medical record, or EMR, is used to describe systems based on scanned images of health information in a hospital, or systems generally implemented in physician offices. So the National Alliance for Health IT defines an EMR as local to one healthcare organization. I think, I think back to early on when electronic medical records were first getting going, and what hospitals would do is scan in all of their paper information, paper records, into a repository, and they would be kind of filed into different folders, health, history and physical, and progress notes, and nurses notes and things like that, into different files. And then the providers could pull them up at the bedside or what have you. But essentially it was just scanned images. And so I kind of want you to think about that when you think of an electronic medical record, or EMR. Okay, so the electronic health record, or EHR, is a system to achieve the goals of structured and standardized data collection that benefit patients wherever they may be treated. Okay, so the National Alliance for Health IT defines it this way, and added that really there is also a dimension of interoperability across more than one healthcare organization when it comes to electronic health records. And I think that's what a lot of you see now, especially if you receive your care at larger health systems. It doesn't matter which part of that system you go, but they have your information at their fingertips. And I think, as we see with Epic especially, multiple health systems are using that, and with Care Everywhere, they're able to really pull up information from anywhere, okay? And this next slide is kind of just a nice diagram that shows the fundamental functions of an EHR. So the Meaningful Use Incentive Program that was developed by the federal government to really drive the adoption of EHR technology in the US added some dimensions to this diagram, okay, that you see here. So initially, the Institute of Medicine defined the fundamental functions of the EHR as simply collecting and integrating data from multiple sources, capturing and enabling the use of that data at the point of care, and then supporting clinical decision making. So that was kind of initially how they saw the functions of an EHR. Well, then Meaningful Use came along and they built on this diagram. And so what they did was added quality measurement reporting and improvement in health information um, and health information exchange. And so the MU Meaningful Use Incentive Program really has driven widespread adoption of EHR technology in the US and really created a foundation of what EHR functionality should, be provided to all providers, or what they should seek out in terms of an EHR. All right. So next, I just want to kind of, clarify here. So you may have heard of the Institute of Medicine's publication To Err Is Human. And this was really the landmark report that propelled the U.S. into action and really described the U.S.'s healthcare as there being a healthcare quality chasm. And that publication asked the nation to do these things under the slide listed here, Visions for EHR. So in order to really kind of bridge that gap and close that chasm, they wanted and called for improvement in the quality and safety of care, and they wanted to reduce health disparities. They wanted to engage patients and their families in their health care, improve care coordination, improve population public health, and ensure adequate privacy and security for confidential information. And so if you want more information on this kind of vision for the EHR and what came out of that Institute of Medicine vision and report, you can go to pages 8 through 11 in the Margaret A. textbook. Okay. All right, so an electronic health record is really a system of components that meet the following criteria. So it integrates data from multiple sources, it captures data at the point of care, and it supports clinical decision making. Okay, and a system is really a set of interrelated elements that work together to achieve a goal. And there are 4 main categories of information systems that contribute to and comprise an EHR. So there's source systems, there's supporting infrastructure, there's core clinical systems, and connectivity systems. And then kind of completely surrounding and wrapping around all of those systems are privacy and security elements. And so we're going to kind of look at system components here of an EHR going forward. So it's really important to keep in mind that and remember that elements in these systems include not only the hardware and the software, but also people, policies, and processes in order to make it all work, right? In order to make the EHR system functional. All right, next, this is a visual. This is a great document that you can find in Margaret A's textbook. It's really a conceptual model developed by Margaret A that depicts the technical components of the EHR. It also shows how the functionality is deployed in various applications and the supporting infrastructure and then the connectivity systems. And so I refer to this diagram quite a bit as I kind of try to keep in mind what is considered supporting infrastructure and what are considered the core systems of an EHR. And so I just want you to kind of locate that within chapter 1 of Margaret A's textbook so that you have it to refer back to as we move through these units. All right, so let's talk a little about the source systems. So source systems collect data, including administrative, financial, and clinical data that contribute to the health record, right? Some examples of basic source systems include ancillary or department systems such as a lab information system, a pharmacy information system, or a radiology information system. A specialized source system, those are distinguished by their clinical specialties such as cardiology or labor and delivery, or by the type of services such as intensive care unit or emergency department, okay? And then source systems may also include smart peripherals such as smart infusion pumps or robotics. All right, so core, core clinical systems, so they enable the use of data at the point of care. Okay, so these applications really support specific clinical functionality and are often considered the applications that comprise an EHR and define really whether a care delivery organization has an EHR. Okay, so the core clinical systems include results management systems. So this is where data from lab tests and other diagnostic studies can be trended. Point of care charting for nurses to complete their assessments and providers to document H&Ps and progress notes. Medication management systems, so these include computerized physician or provider order entry and the electronic medication administration, or EMAR. And then we have BCMAR systems also, and those are barcode medication administration systems, and all of those support the medication administration processes within healthcare organizations. And then we also have clinical decision support systems that are considered core to an EHR. And so this is where data is integrated with clinical decision support rules for supplying reminders and alerts and context-sensitive order sets, or maybe even templates. And so that's a really integral part of an EHR as well, to provide those safety alerts and reminders to providers. And then lastly, reporting systems. So this allows really for the generation of visit summaries, referral letters, quality reporting, patient follow-up lists, and the list goes on and on. So then we have the supporting infrastructure, and really this integrates data from applications that are internal to a given healthcare delivery organization. And so I'm not going to read all these, but just so you understand that the supporting infrastructure really helps integrate data, right? Pulls it all together. And then lastly, connectivity systems, which support the integration of data from different organizations with patients or their caregivers. Okay, so LANs, portals, PHRs, mHealth, cloud computing, telehealth, health information exchange, continuity of care records, and personal health records, which is also listed above. And so I just wanted you to understand these systems and how they work to really comprise and support an electronic health record system. All right, so next I would like you to view Chapter 2 PowerPoint from Margaret A.